Hello everybody, how are you? I had my coffee, I apologize. Thank you so much to Katie Robbins for inviting me to this amazing group. Thank you so much, Katie, for all the work that you've been doing. As I look out on the audience members today and all the participation, first of all, I feel that for my generation specifically those who have been blessed enough to be college educated and to have my father be a military man and sacrifice much of his life so that I could have opportunity. All of those that have come before, it is a huge responsibility, I believe, of myself. It is a utility of my education, my ability to think critically, that calls me to work on this issue. And I thank you all for all of the work that you've been doing. I agree with Michael Lighty that the question we have now is, how do we begin to frame this conversation so that it makes sense and what we've been trying to get happening for over 100 years finally happens? Let me start with this. Single payer must mean that there is an alternative multi-payer. Medicare for all must somehow mean that Medicare for all seniors, as was said earlier, is the option that we might be talking about. The language of healthcare is very important. How we begin to frame conversations, as spoken about by a very distinguished professor, George Lakoff, and also one of my mentors at George Mason University, Dr. Andrew Finn, is incredibly important because that shapes what your opponent can or cannot say. We must first realize that we are not speaking to us who believe in rational conversations. We are speaking to individuals who are moving largely on a basis of irrational fear. It is a rational fear that has dominated this conversation. Let's remember 93, 94, those Harry and Louise ads, which they're so sorry for now. Remember that those ads did not contain one reference to any data. There were no numbers, there were no statistics. There didn't need to be. Because the only utility that that entire commercial piece fulfilled was to scare people. And in fact, a Harvard study later found that during the 93-94 debates, almost 60% of all televised ads were purposely misleading. So we have to remember that our opposition doesn't need to speak to what makes sense and what's rational and what's economical. That's not their objective. All they need to do is say enough so that people believe what they say. And they've been doing that very effectively. So when we approach the conversation from rational policy speak, so to say, well, my numbers just make more sense. That doesn't trigger with people because people, remember, do not vote for economic interest. People vote based on their identity. So when you are speaking to people who vote out of a conservative, family-based approach, and you're trying to batter them with numbers and common sense, and I've had many of those painful discussions myself, you realize that it doesn't work. So what I've thought of is how can we begin to frame the message to be more bi-conceptual, if you will. What that means is, most individuals, we speak so black and white of individuals, no pun intended on my part, obviously, that we fail to remember most individuals hold both lines of thought. Yes. They're not just all conservative, or they're not just all progressive all the way. That's not how people act. People act based in the particular social instance in which they find themselves. You'll find that many conservatives who say, this will lead to ration care. What they said during World War II is, rationed wages makes economic sense. And in fact, those very rationed wages created our employer-based healthcare system. So you have to remember, in developing a biconceptual frame, that this might help our movement more. Let's say, for example, the American Healthy Family Plan. Okay, so if I'm having a conversation with someone about the American Healthy Family Plan and they want to counter it, what exactly would they be against? Are you against America? If you're a conservative, are you against the family? Do you want to destroy your entire identity? Or will you try to grapple to find some statistic to try to disagree with me? That might be a much more difficult effort than if we say, single payer, socialism, we don't want to be the USSR, which frankly, I've heard during contemporary House floor debates that people are already bringing up the USSR. Let us remember that many hospitals, yeah, it doesn't exist, and many hospitals, yes, that's one thing, it doesn't exist, yes, that's one thing.
Small point.
Yes, small point. And also, most institutions in the contemporary Soviet Republic do not have adequate sewage or running water. So even if we move to a system where there's no profit, are you saying that you've ever experienced walking into a hospital in the United States of America and they tell you, sorry, we don't have running water. Sorry, there's a river outside though. You've never experienced that before. And even if we move to a single payer model, which, although the framing needs to be worked out a little bit, even if we move to that, there's still business to be had in innovation, which is the backbone of American industry. You can still figure out amenities, different products that consumers will want to pay for that are not a part of overall healthcare. But what we are saying at the end of the day is not necessarily this policy, that policy. We understand those well. Our basic message is this. There are certain social instances or relationships with human beings that are so vital to our national public interest, they must be shielded from becoming commodities. That's what we're saying. Bottom line, that's our message. And for those who say free market, that works best. When people innovate and think of creative solutions to work with consumers, then they bobble their heads and get all self-righteous, you know? Let us not forget, let us be very clear. Our own American history has shown when people are left to their own devices to create markets and commodities and capital, people think of ways and have historically that now we find egregious, horrible, and socially reprimandable. So, in beginning to frame and shape the debate, we must realize it is a moral conversation. It is a moral conversation, and many conversations we're having nationally now are defining what is a right, what isn't a right. This isn't limited to healthcare, but healthcare is so systemic that our cause and our movement will definitely flow over into the others. Thank you so much.